I'm Charlene Burgett. I'm the administrator at North Scottsdale Family Medicine, and we have a 7-physician family practice. As the administrator, I'm involved with all operations of the practice, from human resources, financials, anything other than seeing the patients. I was first introduced to Talkument through an industry conference, and Talkument OAISYS was the vendor exhibitor at the conference. I was able to talk with the representative and learn more about the system. When I got back from the conference, I had a physician meeting where I had all the physicians, our clinical nurse supervisor, and I sat down together. And I explained to them what I had found from the conference, showed them the marketing materials that I had picked up, and stressed how important I thought this was to the practice. They said, let's do it. And we've had the system in our office for just about a year now, and now I'm getting feedback from all of them. Thankfully, we have Talkument. They now show the appreciation and the understanding. They acknowledge the fact that this was a great idea. This has been able to give us another way to document, besides actually documenting patient visits on paper. We have another way to document information that is helpful to them and can protect them, and also protect our staff and protect the patients. Some of the issues that Talkument has been able to help me address in my practice are human resource issues and any concerns from a patient care issue if the patient's receiving accurate information. There are times where maybe I need to do a little quality control with the staff, so I will listen and have the staff actually sit in the room with me when something happens. I can have them actually listen to the message along with me, and we can troubleshoot together to try to determine where things may have gotten miscommunicated during the conversation. So it's an excellent training tool for my staff. Another way that the Talkument system has helped me is people will call in and not really provide us with all the information that we need, and call back another time and the story is different. So I can listen to the conversations to kind of filter out what the actual message is supposed to be. The other main attribute that the system helps me out with is with our insurance companies that will tell us to expect a payment or that the claim's going to be paid, and we don't see the actual reimbursement at the time that they say that we're supposed to receive it. And then I have that actual resource where I can let them know, I have it recorded that you told me I was going to get this payment on a specific day. It's been a month since that date, and what happened to that payment. There are so many other areas that I've been able to use it, and I've never actually thought that it would help me in those cases. We are a very busy office. We have thousands of calls a day, and we have people coming to us, and if we're on the phone and then we have something happening really in the office, sometimes you forget what you were doing on the phone or who you were talking to. And before you hung up the phone, you didn't get the patient's name or you didn't get the person who's calling name. They can come to me and say, I had a phone call, it was 5 minutes ago on extension such and such. Can you please listen to it and let me know the person who I was talking to or the phone number that they gave me, because I think I typed it in wrong. And so it's been able to give us information that we wouldn't have been able to get after the fact in any other case. Every so often, a patient will come in for a visit that was scheduled. And when approaching the check-in desk, we find that they're not in the schedule. We'll look up in our computer system what happen to that visit and it would show that it was canceled, that we had either called the patient or the patient had called us to cancel it. Well, our system time and date stamps that actual cancellation. So, and it also tells me what employee actually made the cancellation. So I can go into the Talkument system, look for that date, that time, and that employee's extension, and then focus in on the calls right around that time period and actually listen to the message of who canceled it, why they canceled it, and I can go back and let the patient either hear it for themselves or I can actually verbally tell them that this is what happened. I don't want to do it in a punitive way or make the patient look like they did something wrong. It's just a way to communicate with the patient that this is what we have on record and perhaps they forgot. The Talkument software is actually much like Microsoft Outlook, which we use for our email system at the office. And so that made it a lot easier for me when I was learning how to use the Talkument software. You can customize the files and into anything you want, whether it's an employee issue, a patient issue, insurance issue, and then subcategorize them after that. So the fact that it's so much like Outlook made it so much easier for me to actually learn how to use it and then search for information that I want. It might be a 10-minute phone conversation, but you only want maybe 30 seconds of it, and you want that to stand out above everything else. You can set it up where you grab that 30 seconds and you can make a note on that 30 seconds explaining why that is so important. This is what I'm trying to point out in this message, that it proves my point or says what the person states that they said. Before Talkument, we had just the phone system, and the phone system that we used had a record button on the phone which would record the telephone conversation. You don't have the lead in right before you press the record button. Something would happen and that would give the person on the phone the thought, okay, I need to press the button now because this might be where the person's getting somewhat agitated. So they press the button at that point, but you don't know what led into that. Why did this person get agitated? Was it something that my staff said or didn't say? The communication wasn't effective. So I never knew why this was happening. So I couldn't really find a way to educate the staff on how to handle patient relations better. If I could get a system that can give me both parties, record it, and I'm not losing anything, that would be the perfect system, and that's what I found with Talkument. I know that OAISYS has offered a lot of different ways for us to learn how to use the Talkument system, from DVDs to in-house training and even online web solutions. I personally use the DVDs, and I like that method because I could stop them when I wanted to take a break, kind of play with the system a little bit, and then go back and learn the next section. I'm on the National Advisory Board of POMA, the Physician Office Managers Association of America. This is a group of office managers and administrators for physician practices, and we are able to communicate with each other regarding the challenges that we face in our offices. We're able to share information to help with best practices and how we can do the best jobs for our physicians and our staff. Some of the challenges that we have are very similar, and I really think that this Talkument system can assist in solving some of those challenges that many of us face. I'm probably Talkument's biggest advocate, biggest fan. I really, really love having this in my office. It has definitely improved my ability to be diplomatic because I can hear both sides of the story and then come up with my own conclusion. And I think this is the fairest measure to be able to deal with the problems that we see in our practice, and I think anybody in the industry would be able to benefit from this as well. I love Talkument. I can't imagine going back in time to before we had Talkument. It just isn't a possibility. I think Talkument is amazing.